Hello, everyone, and welcome back to Mic Check 2. My name is Rachel.
I'm Aja.
I'm Sean.
And today we have two amazing guests joining us, and I'm going to allow them to introduce themselves.
Good morning. My name is Karen Anderson. I'm the billing manager at St. Hope. I've been currently employed since 2018, and I just love what I do. What brought me to St. Hope was I'm looking for a job. I had two offers. I checked the reviews. I checked exactly what St. Hope was about and what they offered. In the community, they were widespread. And so I decided I would like to be a part of St. Hope. So I accepted the position, and I'm currently still employed.
We love it. We love it. We love it. And
good morning. My name is Tabitha McLenon. I am the Director of Patient Billing. I've been with St. Hope now since 2017. What drew me to St. Hope was, at first I thought it was like Hope Community, but I was like, oh no, I'm in the wrong spot. But as I looked and I researched, I had never been with an FQHC, so I was like, oh, this may be interesting, because I've always been with private sectors and hospitals. So I was like, okay, let me give it a shot. I actually met the COO the same day, and then I met the CEO. And I said, oh, okay, well, nice to meet y'all. You know, we family oriented. And I'm like, okay.
Yes.
So I stayed a little bit after the interview because the HR coordinator wanted to talk, and we talked for a little bit. And I got a call on a Sunday after church. And I'm like, oh, okay.
Look at that blessing.
Yes. So I'm still currently here. I have enjoyed working with St. Hope and its employees. It has truly grew me as an individual, looking at others.
nice. And you ladies are so knowledgeable. I would have thought y'all was like 1998 when we started breaking out the foundation. I thought y'all was shoveling the pavement, getting us started. So we're so happy that you guys have are here joining us. So we're gonna take a deep dive.
Yes, and
I know people are like, they're talking about billing. So yes, the topic for today is billing and insurance.
And more importantly, understanding
of your insurance.
Because everybody got insurance, and you just pull up and you don't even know what you got in your pocket.
pass the
Exactly.
card. Pass what's on the card.
Yeah, we need to see the card. We need to see the card. So let's just get into it.
So me working at the front desk, I know y'all have heard my voice a lot from my current patients. I know y'all have probably heard Miss Karen's voice. You may have even heard Miss Tabitha's voice. But we just want to dispel some myths, answer some commonly asked questions, and hopefully give y'all some knowledge so you can move forward and get proper health care. So, what are the major type of insurances that we accept here at St. Hope?
Well, some of our major insurances that we accept are Aetna, Blue Cross, Cigna, Humana, Medicare, Medicaid, and a variety of marketplace plans that we offer. That we're accepting here at St. Hope Healthcare.
Ooh, so marketplace. I know we hear that word a lot, especially towards the end of the year. Can we talk a little bit more about marketplace?
Yes. So marketplace is funded by the actual patient. They get to pick their own plan, and usually patients pick their plan if they're working for a company. But if the company is offering, one insurance, one product to that plan, that's all they receive. Mm-hmm. But marketplace does not cover a whole lot. A lot of patients, even just me, when I read it, I'm like, ooh, I don't want this. I'm glad I'm kind of like in a situation, I'm kind of stable where I have insurance with, my husband. But nevertheless, marketplace literally covers like office visits. Some marketplace plans covers the hospital stay, but it's more than being with a group, and the group is like a company, individual setting.
And I know the marketplace, just having to call patients and inform them about it. It's like just a plan, like you mentioned, that they can pick themselves and kind of tailor to their needs.
Right.
And when their job may not offer insurance, you have that platform, the option.
Yep.
Okay.
Okay, so what is the difference between Medicaid and Medicare, and can you have both?
Is that part of marketplace or no? That's
No.
So that little red, white, blue card be coming through, and I'll be like,
Come on, Marketplace.
Medicare is a federal insurance for individuals 65 or older. But if you have a disability and you're under that age, you can definitely have Medicare. But also Medicaid is also a joint federal insurance that you can have. And yes, you can have both.
Okay, so care, like you caring for your elderly loved ones. That's a good way to remember. But Medicaid, they cover the same things, just different age groups or situations. Okay.
Yes,
Medicaid,
if you have been
Medicare.
diagnosed with it.
So Medicare is, I know now, because I'm caring for my elderly now, 65 and up, unless you have a disability, you may qualify.
That's correct.
But you have to apply. We don't apply here. We okay, and then Medicaid, is it an age group on Medicaid?
It's a joint that you can have both. A lot of times, especially when you're 65 and older, they offer both for you. So that way you don't have any out-of-pocket costs to you. Medicaid to pick up that balance from Medicare, whatever Medicare doesn't pay for.
Oh, but and then it's also, now I'm getting into it. I'm sorry.
No, go ahead.
Because many moons ago, I used to work at the food stamp office. So telling my business. But so Medicaid, it's women's Medicaid though. That's
totally different.
That's totally different.
Okay. That's for like pregnancies
absolutely.
and all that. Okay.
That's
or
the
prevention.
Prevention.
Texas Healthy Women Program.
Yes. And we do accept that here at St. Hope.
Okay. So that's more for specialized for women though.
Right.
Yes.
Yeah.
Okay. I'm learning. Let me get my little notepad. Medicare. What's Medicare for?
Medicare is your primary. Medicaid is your secondary.
Absolutely.
Absolutely.
It's paying attention to class.
Okay.
Jointly, you can have both.
Okay. And then is that what the difference is with insurance when you, when they say, what am I saying? Co-insurance? That means you have two insurances?
No, we don't.
Not yet, right? So we'll go bring you back in.
You skipping to chapter 4. We're still in front of the book.
Okay, care for the elderly.
We're only in chapter 1.
Okay. I'm learning. I'm taking my
Elderly and
notes.
disabled.
Okay, I got it now. Okay.
So now we have all these different plans, but now we have to decide. Okay, let's say I pick Blue Cross or United Healthcare. But then it has on the little chart on the internet, it has a HMO, a PPO, an EPO, all those acronyms. Is there what is it, and which one would you guys think is more beneficial to a patient?
Me personally, with the experience that I've had, just in the healthcare industry, HMO is always good, and I'm gonna tell you why. Because you have to have a PCP selected, and your PCP drives your care. So if you're just randomly going to different people because you have a PPO, so it's a preferred provider organization. HMO is health maintenance organization. EPO is exclusive. So exclusive is where it's like kind of like they in between, and they're actually like a bridge between HMO, PPOs, POS, EPO, and those are products. People get it confused. Those are products to the plan. That's not the actual plan. So I love to have a PCP, because a PCP is your primary care physician. They drive everything that's going on with you. They know your medication. They know your history. They know what's really going on with you. You got high blood pressure. You got diabetes. You got sickle cell, whatever it is, the illness that you have, they know about you. When you start traveling to all these different providers, they start requesting records, and you're waiting on these records like, why y'all still waiting on my records? So I love HMO, even though it's a little more expensive than a PPO plan would be if you were working for an organization. It's more expensive, I will say that, but literally your copays, kind of like they're a little bit lower than a PPO.
So it balances out.
That made a lot of sense, but because I'm a traveler, anybody can see me. No. I'm first available. First available.
I'm not saying it all over again. No, I want to walk in and I'll be like, remember what we talked about last week? It's bad.
Yeah.
Remember we talked about weight management?
No.
Okay.
No, I don't.
It comes fluid.
No. Hey, last week I talked to somebody about this, and I'm gonna bring you up to speed because some ain't right still. Like, that's me. I'm fine with that. Right. So I guess insurance, it sounds like preference.
Right.
Yes.
Oh, okay.
And I can tell you also, just to add what Ms. Tabitha stated, HMOs too, once your provider knows, they contract you with different providers. If you need to go see a nutritionist, they're going to refer you to that person. And a lot of times they have a team that they work with. So not just with the PCP taking care of your needs, they're going to also make sure that you're going to doctors that you need to go to. If you're your levels are elevated, they're going to send you to a hematologist. They just have a team that they work with. So HMOs are good, but you always need a referral with the HMOs, and your doctor can also refer you to those providers.
Okay, I'm learning, because I thought I never knew the difference. I thought it was just, you see the little suitcase on the insurance card and it just says PPO or HMO.
Yes.
You knew the difference, Sean?
I never paid attention to the suitcase.
It's a little suitcase.
It is,
right?
It is. And it'll have PPO in that suitcase or HMO in that suitcase.
I never paid attention to
Yes.
Yeah.
But that's really important to know, because a lot of times patients will come in having HMO and not understanding why they need a referral.
Yes.
But it's because you kind of already have a community team
Yes.
that they want you to kind of stick with, who
Yes.
knows your care.
And that was the only thing I knew the difference about.
You know
Don't come up in here with them other acronyms. I do not know.
Oh, yes.
I do not know.
I'm going to check my card and make sure it says PPO, because I'm on the go.
One thing I know for sure, if you're coming to St. Hope and you have an HMO, you have to either change your PCP or you have to have a referral.
That's correct.
See, I know that too.
I know. They tell me that every morning.
It's me with the card at the front desk. This not one of our providers.
This person, he don't work here.
Right.
So that I guess that can be like the only, I guess, con, because it sounds like it's a really great benefit. You don't have to keep repeating your story, but if you do need a little flexibility, you kind of have to wait on that referral.
Yes.
Or change that PCP. And that's pretty easy with a phone call typically to your insurance to get that changed. Okay.
Now with the PCP, is that you only have to choose a PCP if you have a HMO?
Correct.
So if we have a PPO, it could just be blank.
You don't have to, but I suggest that you do, so they can take care of your needs. You want to go to one PCP. You want that PCP to know your history, follow your history. Yeah. So that way you won't be going to this doctor and that doctor and this doctor. So it's kind of best to kind of choose a PCP of your like.
Okay.
I feel like a billing nightmare because I'm everywhere.
They'll be over this.
Yeah, I'm everywhere.
Oh, this girl that came up.
She done changed her PCP 3 times this year. That's me.
They like to stay with their doctor.
Your claims look like a CVS receipt.
And I can tell you too, a lot of times at the beginning of the year, insurance will change your PCP without your knowledge. So a lot of times those patients call and they're not even aware that the insurance have changed their PCP. And that's because they have not put one on file. So they're going to select one for you until you call in and make those changes.
I get that a lot.
Yes. And it's unfortunate, but it happens a lot.
It really does. So at the beginning of the year, and I just say this based off working at the front desk because these two ladies are my go-tos when it comes to insurance stuff.
January 1st, you on their line?
When January comes,
everybody calls.
We always roll out. I was like, here we go.
But Sean has learned a lot.
Yes.
But
He's rolling with it.
Yes.
But I guess that's really important. Even, so everybody knows my child, she has sickle cell. So even coming in at beginning of the year, towards I know like June, medications are free. By the time we hit June, I'm loving June.
Yes.
We done met all our deductibles. I'm loving June.
Oh, yeah.
January, very humbling. I'm like, she needs it.
She needs it.
She needs it. Yes.
January come, I'm like,
Yeah, she needs it.
she needs it.
But you know they have copay prescription cards like Good RX.
Yeah, they do.
Oh yeah,
Optum.
we on it
RX.
all. We on it all.
Yeah.
But can we talk a little bit more about the deductibles and
yes, I was just about to say because since she brought up money. Now there are times when patients come in and we have to tell them. They may think, "Oh, I got insurance. This is a free visit," and then I hit you with you have a $45 copay, and they're like, "Wait, what's a copay?"
Me.
That's you. So,
I be like, this a what?
a copay.
A copay, a co-insurance, a what?
Yeah.
You haven't met your what?
So let's talk. Let's
Let's
copay.
start with copays first. That's the most basic. That's the base.
Right.
So what is our copay?
Okay, a copay is if you have a plan that has a deductible, your deductible has to be met, or you meet that deductible by each visit, and then once that deductible has been met, you can pay your copay. It could be $20, $30. It may not be no copay, but you have to meet that first. So if you do have a plan that doesn't have a deductible, it goes straight into your coinsurance. You may have a coinsurance that's $4,500. So you may have 20% on that. You may have 30% on that until you meet that $4,500 or $2,500. Then you become, your copay kicks in. And so when you come to the doctor and they say you have a $45 copay, apparently you've met your deductible. No. Because it wouldn't go to that. It would be a deductible first and then your copay.
I have a real quick question for you, Ms. Karen.
Sure.
Now, I know when patients are listening to this or watching this, they're going to be like, oh, so let me just automatically choose a plan with no deductible, so I automatically get my copay. Now, if you don't have a deductible, doesn't that necessarily mean your monthly premium may be higher?
Absolutely.
Okay.
Absolutely.
That's,
Look at Mr. Royal, would you like to come to Bill?
yes.
They're hiring them.
Yes.
I would like to note too, the companies do not, like St. Hope, we don't make their copays. It's already pre-printed on
part of your agreement.
On your, because a lot of times, because sometimes with specialties, it might be a little higher copay
it is.
Versus your regular visit. And I think a lot of confusion comes that people think that St. Hope is making this copay. This is what your insurance card says.
That's right.
Yes.
That's your
the one
agreement.
with the suitcase on it.
Yeah.
And a big thing people don't realize is your copay amount is actually on your card already,
Yes.
and they don't even see it. Your
That's
specialist visit is already on your card. So when we tell you $80 for a foot doctor visit,
right,
and you say no, it's not, sir. If look at the bottom portion of your card, right there,
yes.
it's right there.
It is.
You do have those plans where the specialist is probably like the PCP, but 9 times out of 10, your specialist is always going to be higher.
Right.
So a lot of times they come in thinking, oh, but that's my PCP. No, sir, you're seeing a specialist. And so it's a little bit higher.
So
they want.
Yeah, so internal medicine is considered as a specialist. It's not family practice. And we do currently have an internal medicine.
Oh, nice.
Oh.
A shameless plug.
Our internal medicine is Dr. Sims.
Oh,
Sims
you
don't remember that? Patients was going back and forth.
Yes.
And they was
Flip
like,
your notebooks. Flip your notes.
Look, let me go through my notes.
He got it.
He's in his notes.
Because he always be like, we said this on this day. But yes, a lot of patients don't realize that when they're going to see these different physicians, what type of provider you are going to see. If it's not family practice or general medicine, everybody else is a specialist.
That's correct.
Everybody.
That's a good point, because sometimes people come in there and be like, but my card says 40. They
Yes.
begin to look one line down.
Yes.
It says
And I
specialist.
think it's actually on our website too. So even if you're trying to decide a provider at St. Hope, you can actually see, I think, like Dr. Briscoe says, family practice.
Family practice,
Yes.
or family medicine.
And then you have Dr. Sims that says internal medicine.
That's correct.
So when y'all are looking at the website trying to decide your doctor, make sure y'all are reading the fine lines and looking at your insurances.
Okay, so what are some factors to consider when choosing an insurance plan? Like, what should patients be on the lookout for when they're deciding, like, do I want insurance plan A or insurance plan B? What should I look for?
Coverage.
Okay.
Oh,
So,
one period.
deductibles, I would definitely say a deductible. In and out of network. A lot of patients say, but it says y'all in network. Yeah, but what product do you have? We take Blue Cross Blue Shield, but we do not accept My Blue Health. My Blue Health is a part of Market Exchange. If they say, well, y'all say Aetna, y'all take Aetna, yes, but we're not a part of Better Chip Medicaid. That's a part of Aetna, which is a product. So
It's
when
like layers.
it's different layers to it. So even when you go to the Texas Health Department services, a lot of them say, yeah, they take it because they're looking at our website, but they're not looking at the actual products. And I asked for this it's a couple of years ago, but it's so many products, guys, that is out there that to choose from, to think about. And a lot of patients, they forget from time to time, because even me, sometimes I forget. I'm not going to even say I don't, but I'm like, ooh, hold on a second. Yeah, we do take it. But then when you get to calling and you're asking for these plans, and just make sure that if you are a sickly patient, please do not choose anything that you know that is not covered, because it's limited.
Yes.
It's limitations to every plan that you pick, though. So
You just got to figure out what's best for you.
what's best for you?
Coverage.
Yes.
Coverage.
Hashtag
Coverage.
Yes, coverage. Yes, because a lot of times you choose a plan, they don't tell you this limited.
Yeah.
That limited means you may have only 3 visits per year. And after that fourth visit, you're paying out of pocket.
Right.
So be careful when you hear limited, you want to know what that limited plan includes.
Yep.
So
I feel so bad for I really do feel
Yes.
bad for patients when they don't know, especially
They
the
don't
elderly
know.
ones.
Yes.
They'll come in, have 2 or 3
Limited plan.
visits.
Yes.
Yeah.
Next thing you know, by the time November, December, toward the end of the year, and they need to do their little annuals and whatnot before
Yes.
everything starts over.
Right.
You got to pay over this much to come
And a
and be
good resource would be just to contact that insurance, correct?
Yes.
Correct.
And they can kind
Sure.
of go through everything
Yes.
that you're...
Yes.
Okay.
But
So
sometimes
when in doubt, call
Right.
your insurance.
Yes.
Right.
If you're unsure.
Sometimes they don't. When you get an advocate over the phone, you're not asking the right questions. I'm gonna be honest. Sometimes that person is on the other end and they're just talking and they're trying to hear what you're saying, but they just a customer service representative that's just trying to answer the phone or trying to assist you in any way that they can, and they may not have the suitable answer for that particular need that patient is asking about. So it's kind of hard. This is why I chose this field, because I had marketers knocking in my grandma and my grandpa door, and when I first got in the field, I'm looking like,
That's not a
Sir.
good plan.
Yeah, I'm like,
I heard that.
That's
and this is a Medicare replacement.
Yes.
How is it replacing anything? It should have the same benefits. I read it should have the same benefits Medicare has.
Right.
And he's looking at me and he was like, well, it does. And I'm like, no, it doesn't. No,
Right.
it doesn't. Pack your booklet, pack your suitcase, So it is. It's hard and it's challenging when you come to insurance because you're trying to figure out, is this best? If I really get sick, is this really going to help me in the future?
Yes.
So the number one question to ask you, what is my coverage? What am I
Yes,
actually
I think-
paying for?
And it
What
sounds like
coverage?
you should just be as specific as possible.
Yes.
Because I know working in case management. one thing I always tell people, I said, call your insurance
Yes.
and see what tier your medication falls under.
Yes.
Because when
Yes.
my card say generic, find out that's not no generic. What you taking is not a generic. The generic is not on the market.
Right.
So you have to pay
Yes.
that money. And it's so unfortunate that sometimes people lock into
It
these
is.
insurance plans and then the medications that they really need are not covered or
That's
they're
right.
so expensive.
Right.
So I always, that's my rule of thumb, check on your doctor and check on your medicine.
Yes.
Before we...
Check your plans, check your deductibles, check in and out of network. Do I have it? Because if you have out of network, you're able to see your payment may be a little bit higher, but you're able to see some of the providers. So yeah, all of that is very important to be asking once you call your insurance.
And when you're choosing your insurance, you can ask the insurance companies or the representatives, is this person in network with what I'm about to choose?
Absolutely.
yeah.
Yes. If you're used to seeing your provider, you definitely want to do that so you can continue your continuity of care would be with that provider
Because
still.
I get that a lot. And sometimes
Yes.
patients will say, I want to sign up for new insurance, but I don't know which one. And so I always recommend, I'm like, well, if you call them, just say, hey, this is who I would like to see.
Yes.
Let's start there. Yeah.
Let's start here. This is who I want to see, Sheila Briscoe.
Absolutely.
Do y'all accept? Is she in your network?
Right.
If no, okay, let's go on to the next plan.
That's correct. That's
Exactly.
correct.
That's
And if
correct.
she is in your network, what can she do for me? Like, is she
Yes.
gonna be able to be
Like,
my
what are the
my
coverages
primary?
if
What
she's
is
in?
my coverage?
What is
Where
my
is my
coverage if
coverage?
she is in my network?
That's
Right.
right.
Yeah.
And they'll tell you, oh, that's just one visit, and that's how you know you have a limited plan.
Yes.
Look at us learn.
Oh, yes.
Look at you.
So what does it mean when the person is out of network? Like, what does that term actually mean?
Versus in network.
That particular provider is not credentialed. And so a lot of patients think that we at St. Hope govern that. We don't. The insurance company governs that. So when My Blue Health first was introduced to the market, patients was calling like left and right. Well, y'all say y'all accept Blue Cross. We do. We accept Blue Cross Blue Shield. But My Blue Health, when they first introduced it, they sent it to different people in the market area. Unfortunately, when we got ready to enroll, at the beginning, we asked, could we be in it? Because there was so many of our patients picking these plans. And by the time we got ready to enroll, they said the panel is closed.
So like they at capacity, they don't want no more people.
Absolutely.
Okay.
We got too many nurse practitioners on it within y'all radius. So they literally go by zip codes. So if they go by your zip code and you got 65 NPs in the FQHC and literally y'all within 20 miles of radius, we got too many in the plan. So we're not going to allow you to come in. So sometimes I will say this. Sometimes when patients actually make the phone calls to the insurance company and say, please, can y'all please get I don't want to change doctors. Sometimes the insurance companies, especially if they talking to their actually advocate or the person that actually signed them up with this particular plan, then they would definitely, or they can go to their HR. HR always is your advocate when you're trying to pick insurance.
Good resources.
Because what your job is offering you. Go to HR. We tell them that as well. I don't know what my insurance is. I don't know. I just selected something. HR selected. Well, go back to HR and see exactly what your plan is.
Your coverage.
Your coverage.
Your coverage.
Yeah.
That's your word.
That's my word of the day.
Yes.
I'm about to go research our benefits. What is my coverage? What am I actually getting today?
Okay, so let's say I just, I was irresponsible. I did any, mini, miny, mo when it came to picking insurance. But I'm just saying,
they lost their brand.
hypothetically, nah, hold on. Y'all can't, if y'all viewing, y'all should have saw the way Tabitha looked at me like, you know better. Okay, so let's say I just did any, mini, miny, mo. I picked a plan, The provider I want to see is out of network. What does that mean for me? Is there hope
Can I still see my provider?
If you chose your insurance and you have out of network benefits and that provider is out of network, you're still able to see that provider, but your fee is going to be increased. It won't be like a normal $40 copay or $50, which you're used to paying for a PCP. It'll be more.
And so
they can charge just about as much as they want. Like if we're used to paying $90 a visit, they can charge $120 because it's out of network.
And in network
means
I can only see who I put on my paper.
That's correct.
But you get to pay the copay.
The copay. Which is your
as long as you met your deductible.
But this is why you should.
Absolutely. Once you have met your deductible.
But this is a prime example of why you don't do any, mini, money, mo. Especially if you want a certain provider. You want to make sure your coverage.
Yeah. Do your research before. Don't just choose a plan because you
learned it.
You have, you're in time. I got to do it right now. Research it and find out if your provider's in.
Even when we get older, I really pray and hope that Medicare is still around. I really do.
That's
don't jinx us now. I hope so too. I hope so too.
Y'all taking it out my check and y'all making sure.
Right.
It's coming out my check.
And it can be challenging.
It is.
Now, when we talk about challenges, I know a lot of our patients face different types of challenges with health insurance. How do you guys on our St. Hope Healthcare best remedy to those issues, or y'all try to attack it before any kind of issues can occur?
We try to attack it before the issues occur. And we do that by text messages, emails, phone calls. Literally, we tell our staff to make sure that they are 72 hours out. So it gives the patient time enough to say, can I really afford my copay when I go in? And if they can't, literally, we have payment agreements that a patient can set up a payment arrangement.
Yes.
But we prefer that they pay their copays at the time of the service because we have a contract with their insurance company states that you should be collecting all copays, all deductibles at the time the services are rendered.
So
Should we say that?
So that's
because I don't want people to be like, Tabitha said I could get a payment plan.
No, that's not necessarily the case.
That's not the case.
Okay. Only if you're unable
to pay.
And so we don't turn down no patients.
Right.
We try to work with you to make sure that you get your visit.
Yep. And the good thing is that billing department has zero complaints when it comes to that.
We love that.
That's why in the beginning, sometimes people feeling like everybody just want to be in their business. No, we just trying to make sure
that you
right.
Yeah, so when you calling and you're a new patient and they like, you got insurance, have the insurance card ready.
Right.
So that they could go ahead and verify it. So you're not spending extra time in the lobby to on the back end get it verified.
And that's why we reach out. We reach out to make sure that we can get that information prior to them coming in, and we're able to run those benefits, before they get there, reach out to them like Tabitha stated. SMS text, phone calls. We even do voicemails. We pick up the phone. We just want to make sure that you're aware before you come in that, you know, what your responsibility would be.
Right.
So please, it would honestly, and me working at the front, I go through this a lot. A lot of times when patients are scheduling, sometimes just to hurry up and get the appointment scheduled, they'll be like, okay, I don't have insurance. But then they come in, I have insurance.
Yes.
Right.
Sometimes you may not know this. There is a whole process on the back end. So
It is.
you may be waiting in the lobby an additional 20, maybe 30 minutes.
Absolutely.
You never know.
Right.
But it just helps to just put that out there up front. Make sure you have your PCPs in line. And then a lot of times if they get the call, if you check your voicemails, I know we run into that a lot.
Or your text messages.
Or your text messages. Because
Yes.
I've seen the messages and the ladies will say, hey, you need to update your PCP.
Right.
Please
Before
update it
coming-
before you come
to
in.
the-
Because
Yes.
if not,
It's going, yeah.
And a lot of times that happen, or they don't have like one of those normal commercial plans, those major plans that I mentioned earlier. They'll have an independent insurance. And so it takes us a minute to call. And sometimes we can't get through right away. So it is a delay. So we just ask that. You know.
And we all dread that.
Yes.
Call volumes are extremely high at the moment. Your wait time is 45 minutes. You be like,
Yes.
oh.
Yeah.
Sean, can you tell them they're going to be there for about 45? Sir, so here's the deal. Unfortunately, if you don't mind.
Yes.
Go ahead and have it. Go get you some lunch. We're going to be here. Go
For
get
another
30
30
something to eat.
minutes.
Yeah.
Now, I do have a question. We're going to verge off the question just a little. But I
Okay.
do have a question. Because I know it does happen. If a patient is unsure if they have insurance, like let's say they don't sign up, you guys are still able to find
Most of the time we are.
Yeah.
And if we don't, pharmacy does. And they inform us, hey, we just found insurance on this patient. And we have to still dig a little deep, you know, because we're looking for the 4 verifications that we do on all patients. But sometimes it doesn't come up. So we have to dig a little deep and find, okay, this is Blue Cross. This is Ambetter. This is whatever we found on them. But we do find it.
Correct.
Somebody.
This
That happens to
we
me.
will find your insurance.
We will.
If
Hey,
you're unsure, you lost that card 2 weeks ago, it still ain't came in the mail. We would. No, it's kidding.
Yes.
We're gonna help you find it if we need
But
to.
to add to Karen, as well, patients will say this all day long, but they had to sign the agreement as well. Just like we sign an agreement when we're credentialing our providers when they've been prior, or even if they've already been credentialed prior to them coming to St. Hope, or any organization. Literally, a doctor knows what plan they've been on, what plan they accept. Hey, well, it shouldn't be a long period of time. Sometimes we do run into some hiccups when we're doing credentialing or when we're assisting our credentialing director. Self-funded and self-insured plans are totally different than what we're talking about currently. So when you're adding to that, a lot of patients say, I don't have my card because they know that those plans are kind of hard to find, especially if they don't give us their social.
So you need to open up a whole other gate. We're
That's
gonna have to
a
have a
whole
part
other
2. We're gonna have a part
Billing
2.
part 2.
Billing part 2.
Yes,
But
yes.
yeah, I think it's just important because even I would say like my mom, if she had insurance, she probably would forget.
Yeah.
But
Yeah.
I know some people.
And it
that-
happens like a
it
lot of the
happens.
elderly
Yeah.
patients.
Sean is right.
You'll have a marketing rep come out and they'll sign you up for insurance. You don't even know you have it. Next thing they at the doctor's office and they say, "Oh,
That's
well, you
correct.
have Ambetter," and you're
Right.
like,
Yes.
"Oh."
She's an easy target. She'll sign a friend. They came to her house selling that water. She was like, "Sign me up." They want to redo the roof. Sign me up. Like, don't go to my mama's house,
Yes.
y'all. Please let her be.
And don't fall for the little
And that
swag
happens a
bags.
lot. They have so much solicitation. You'd be surprised. They calling you on the phone. They target the elderly because they
do.
know they'll sign up for it.
Yes.
They offering things that don't
Even
include the
exist.
package. Yes. And so leaving cards on your front door and, just different things how they solicit.
So make sure you ask for your coverage.
Ask for your coverage. And if you're not
Coverage.
sure, have someone around that may be more
to
knowledgeable than
assist
you
you.
to
Yeah.
assist you in choosing your
Yep.
plans.
That's correct.
That's so correct.
And so, so for instance, if the people are coming out to your home, you don't necessarily have to sign up with them that day. You could probably just get the information and then follow up.
Yes.
Or have
Yeah.
your
They're just trying to make it
granddaughter-
quick. They're trying to make a
Yes,
sale.
They're trying to make a sale.
Absolutely. Research it.
Because as long as you're in the plan, they get paid.
Yeah.
Yes.
Sound like a little commission.
Yes.
Watch out.
Well, I feel like I don't know about you two, but I feel like I learned a lot.
I feel like I did too. I gotta stop calling my mama. And I just forget. like, Mama, these people, they told me $90.
What is not? And 90s on your card.
Your card.
Just smiling at you. Ain't it? Just
Girl,
looking at
I'm
you.
like, what you mean a deductible?
Now,
I thought I was paying $20. I didn't
Not
read
today.
the other part after the 20.
The fine print.
The 20 doesn't start until you meet your deductible.
After the deductible
After
is
your
met.
deductible has been met. That's
So
it.
keywords to look out for: your coverage, deductible, and your product.
Yes.
That's my new word. Product.
I like
Product.
it.
Yes.
Me too. I was surprised.
Now, do y'all
one more
have?
question?
I do.
Okay.
So, do y'all have resources where people can educate themselves better on health insurance? Like, where can someone go?
Websites. If I'm going to Aetna, I'm Googling everything about Aetna. And if it doesn't have the answer for you or for me to assist somebody else, I'm picking up the phone and I'm going to call. Then I'm getting a rep's name. I'm getting a rep's number because I'm going to remember who I spoke with on what day and what time.
And that's it.
Yes.
Straight to
If
it.
you're just not computer savvy like some of our elderly, make sure that you get assistance to help you with that. 'Cause
Exactly.
They, you know, a lot of them don't ask the pertinent questions, and so they just hear the first thing, $20, and it could be $20 just to talk to you, you know. And so we don't want patients to just get it confused.
Y'all may sign up for a $20 copay, and there's
Yes,
a
and that's
$50,000 deductible, and
Exactly.
you're
Yes.
stuck for the
And
whole
when you
year.
come in, yes,
whole
they
year.
can tell the elderly that, or somebody that just don't understand or not computer savvy.
It's true.
And then my final question: insurance is calendar, January to December, right?
Yes.
Coverage. Okay.
Look, she trying to
But
make
not
sure.
every
I'm
plan.
sure I'm
Not
like, I
every
gotta
plan.
Not every
I didn't
plan.
plan St. Hope's.
Oh.
I was started in October this year.
But it's October. But it's gonna be like
it's
a
year-
October
yearly.
to October.
Calendar
Okay.
year, yeah.
Calendar. Okay.
So wait, October to October. All
For
right.
a lot of
Trying
times,
to do
it'll
my
start in
bad.
January. So that's like,
Yes.
so
The
for,
normalcy.
the normalcy is January. So that's when, if you'll get a calls and texts from the billing department, or if you have someone from a front desk call you and say, hey, we need you to update this, and this, that's because it's the new year. A lot of things have reset.
Yes.
New insurance, who this?
Yes.
Yes.
And I know a lot of times too, open enrollment for plans start in October. They start soliciting in October.
October.
Yeah, so
Yeah.
you can have it already ready for January.
That's
already
when them, that's when them
enrolled.
commercials be
Your
all on the
bummer
TV.
Yeah. The commercials
I'll be like,
and all
ooh,
that.
You see that on TV a lot. Yeah.
It starts October 1.
Yeah. Okay. Good.
it makes sense. Okay.
Oh,
I feel like I know a
have
little
one-
something.
One more question.
One more. One more.
One more.
Because I know a lot of patients don't like to pay or have insurance. It's always, for me, I don't know, it's a matter of preference because some people just really don't like it. They just want to say, I'll just pay self-pay. But won't you guys agree that having insurance is better just in case if anything may go wrong? Like if you need to see a specialist on top of your doctor's visits, or if you need to go to the emergency room.
Absolutely.
Yes.
Absolutely.
Oh, absolutely.
Everybody needs to have
But
some kind of insurance.
the key to that, I did explain this to Audra like a while back when Audra was asking questions, and she was just trying to educate her own self. A lot of people don't realize that once you are hospitalized, you paying for every doctor that come in that room. You paying for the nurse that walk in that room.
Cotton ball.
Yeah,
For everything.
Literally,
Yes.
like anesthesiologist. And I'm gonna be honest with you, nowhere in the great state of Texas is an anesthesiologist credentialed with an insurance company. Not one. Why? They don't want to give you a contractual. Contractual is a discount. They don't want to settle for, I'm only going to pay you $200.
Right.
So you got an anesthesiologist, you have the radiologist, you have the doctor who actually did the surgery, or you have the assistant, you got a PA. So you got a PA, you got an MD, you got an RN, you got a bill. You got a bill.
Yes.
So,
You gotta pay for
it's,
the bed you're laying in.
yes. So if you got a large
All
deductible,
services.
it's going to meet it.
Yes.
But at the same time, think about how much money you're spending out while you're in the hospital.
Yes.
I know for me, when I had my major surgery in 2021, when I looked at the bill, I said, MD Anderson, you must have lost your everlasting mind because I never used the phone. I just used y'all electricity to plug up my phone and make a phone call. But yes, when you're having a major surgery, it is so expensive, and a lot of patients don't realize it. Sometimes I wish I can apply for Medicaid, but then they tell you you're over the FPL. I'm like, oh, okay, but it's very expensive to live, and it's very expensive to die.
Yeah, and I mean, this one of the things too, like for me, you might feel like I'm a relatively healthy individual. You know, I go to the doctor for like my checkups and everything like that. But in between, I'm not really doing anything.
Right.
I broke my ankle. I broke my ankle in April of last year.
Yes.
And that wasn't on my bingo card.
Right.
I wasn't expecting that to happen. But luckily, you know, I had insurance because my hospital visit, not my surgery, my hospital visit was a nice $15,000 when they sent me the itemized bill.
Yes.
$15,000, not my surgery.
That's right.
It's crazy.
That's totally different.
But luckily,
With
good old
insurance.
insurance, that hospital visit,
Yes.
Knocked
It
down
was
a little
covered.
bit.
it was covered. So
Yes.
even if you do feel like you're relatively healthy, I do feel like some form of coverage. It's a nice safety
necessary.
net because you never know what happens.
Yes.
Car accidents happen,
Absolutely.
Yes.
slip and falls,
Anything
anything.
can happen.
Anything,
It's either
yes.
live in a bubble or get some insurance.
Yes.
Yes.
And live freely.
Yes.
Yes. That's true.
Because we ain't gonna talk about Payne's bills. I'll be like, we're still here. How
Yes.
you sending me the bill? We are still here. So definitely get some insurance.
Absolutely.
I do want to thank you ladies for coming in and giving us some really helpful information. We appreciate you guys so much. I'm still going to be calling. But, you know, do you have anything else that you would like to touch bases on or any other tidbits that you would like to give the listeners?
I would just add to check the websites. Don't make fast decisions. Review the different type of plans that are offered. If you only have one within your job, then of course you want to go to HR and get all information that can help you. But if you're going with somebody independent on the outside, just review it. Make sure that you're looking at the coverage and see what that plan would offer you. That's what I would say. And just be careful of the solicitors that's out there. Make sure that your plans are, if you are a person that needs care a lot, don't get a limited plan because it, you know, after 3 or 4 visits, it's actually exhausted. That's what my takeaway would be.
I just want to say one thing before you say, just because
Go
it's glitter
ahead.
don't mean it's gold.
That's
There you
correct.
go.
Solicitor.
There you go.
That's correct.
There you go. And it is very important to have coverage. So if you don't have coverage and you're thinking about, I'm feeling sick now. If you are sick, I have noticed, and Texas is not supposed to do this, but they do it. They cannot turn you away for healthcare needs. But I do notice now that they are sending a lot of patients to county hospitals, and you don't want to sit in a county hospital all night just to be seen because you got a cough or you got fever. So I always tell people, even if it's something small, go get it. You know, maybe you can't afford it every month, but take out something that you really don't need and make sure that you have some type of plan. They have so many marketplace exchange plans that's out there now that fill up under the Obamacare rule that you can get. It may not be a whole lot of coverage, but you're covered.
Something better than that.
Yes.
Something is better than nothing, exactly.
Yeah, love that.
Me too. But you know me, I'm sticking with my coverage.
You need the full coverage. You need full coverage.
Take that little deduction out and keep going.
Yeah. Make sure y'all take that out. That's the one deduction I don't mind seeing.
Exactly.
Y'all can have that one.
If you have any questions or you need to schedule an appointment, please call 713-778-1300. Or don't forget you can use the chat feature on our website at offeringhope.org. We love you guys. Make sure you have your insurance card ready though, just to save a little time. And remember, at St. Hope,
You're more than just a number.